Join us for our 2.5 day in person hospice operations certification workshop in beautiful San Diego, California, August 23rd to the 25th. Learn the skills to enhance quality care, operational efficiency, and strategic growth while advancing your professional development as a certified hospice professional operator. Space is limited, so register today at cfe.chapinc.org.
Greetings. I'm Jennifer Kennedy, the lead for quality at CHAP, and welcome to this month's CHAPcast. I have the pleasure to talk with Maria Warren today from McBee about home health care episodes. Hi Maria, how you doing today?
I'm doing well. Thanks for having me. How are you?
I'm doing great. So for all of our listeners out there in podcast land, could you tell us what you do at McBee and you know, what does your job and world look like on a day-to-day basis?
Well, sure. I'll start
That's
off
a lot,
with
right?
right. There's no such thing as a perfect and ideal day, but as you mentioned, my name's Maria Warren, and I am the Vice President of Clinical Consulting Services at McBee. For those listening that are not familiar with McBee, we began back in 1973, so we're almost 50, just shy of 50 years young in the industry, that we have a great tenure and provide healthcare consulting services across the healthcare continuum. So everything from clinical, financial, and operational strategic advisory services to help our clients overcome any obstacles that they may be facing, help them improve and achieve sustained results. I've been with McBee now for just celebrated my 12-year anniversary.
Yay.
And yay! And through that time, I had a various roles across different departments and areas within McBee. Started off in revenue cycle, did some strategic consulting, interim management, positions, project management on EMR implementations and feature functionality assessments, and then realized that throughout all of them, I had such a connection into the clinical consulting world, and took over leading this group probably about 4 years ago now, where my two teams focus in on helping, one being our episode management team that we'll talk a little bit more about today, and improving clients, helping them achieve optimal episode management through mitigating their LUPAs, increasing their overall adherence to the plan of care, and managing those periods per episode a little bit better, where possible, optimizing revenue tied to it across those 2 30-day periods. And through all of that, we'll talk about how it ties into value-based purchasing and improved outcomes. And the other team that I oversee is our clinical compliance team, who focuses on everything from internal compliance initiatives such as pre-bill quality reviews, QAPI, mock surveys, so ties into a lot of what you do at CHAP. As well as helping with focused medical review, and also supports a lot of organizations in their merger and acquisition support services in completing those clinical compliance reviews.
Wow, that is just literally a ton of stuff that you've got going on there at McBee. So I wanted to start off because I heard the words optimally manage an episode, and that caught my attention. You know, just to let you know, I am a novice in today's home health realm. I left home health back in the mid-90s when it was all sort of going sideways, and went to the hospice world. But what is involved for a provider who is optimally managing an episode of care for a patient?
A lot goes into it. So I'll start off on giving my definition of, episode management, and how we define it is that continuous and proactive patient episode of care review process, really, which allows the providers to demonstrate the pursuit of CMS's triple aim, to go to increase the health of the population, experience of the care, and per capita cost, and reduce the per capita cost tied to it. So when you think about what's involved in optimally managing it, that episode of care for the patient, the number one thing that we tie it back to is oversight of that clinical manager and case manager. They essentially play the role of air traffic control in coordinating care among that interdisciplinary care team. So that clinical manager and case manager are responsible for ensuring that communication across all the disciplines, as well as with the physicians and other members of the healthcare team, to keep everyone informed on changes to the patient's status, changes to the plan of care. So it's important that everybody's communicating and collaborating to make sure that, most importantly, the patient's getting the care that they need and their needs are being met as part of it. One thing that we always recommend is instituting at start of care some type of huddle or case conferencing, so that you're getting collaboration across those disciplines. So when everybody goes in and sees the patient, they're going in at different days on different times, they're seeing different things, so that they're able to come together and talk about that assessment and evaluation of the patient, which then helps the care team establish the most effective and efficient plan of care that's patient specific and really focused on achieving that patient stated goal that they outline.
I heard you say coordination of care, and that, I think that for any kind of provider in any space, coordination of care can be very challenging, depending on the individuals in the group, what's going on in any given day, the patient and family themselves. So, given that coordination might be one of those challenge triggers, what are some other things, and you can feel free to expand on coordination of care, but what are some challenges that you see that really put the kibosh on that optimal management of an episode?
As I said earlier with my day, there's no typical day. You're always faced with some sort of challenges and obstacles, no matter in every single department within the organization. But then on the other hand, you're going into a patient's home who they have, they may have caregivers, they may have pets, depending on what they have going on in their day. Every single day is different. So when you think about all of the challenges and encounters that could be faced, they're driven on the provider side as well as on the patient side. Provider side, I mean, the biggest thing right now that we see is with a lot of the staffing shortages. Do we have enough clinicians to be going out and seeing all the patients? Also, then on the patient side, it's driven on, is the patient refusing a visit? They just don't feel like having the visit today, or are they outright refusing an entire discipline? A change to the patient's needs, may be also driving it. They may be rapidly improving or just having a feel-good day, saying, "Oh no, I don't need that visit today," or they may be declining and moving or missing those visits that may be tied to some of those staffing challenges that I talked about. So you want to make sure that when all of these changes are happening and all the challenges that you're facing, how do you still keep in front of the patient and keep them engaged? So that could potentially be through just a care call with them to say, we understand you don't want to visit today, but let me check in. How are you doing? Or trying to do it via telehealth if you can't get out there. Because the most important thing is you want to make sure that you're checking in with the patient and keeping them safe in their home. So that's really where that strong oversight of the patient and that ongoing collaboration, everybody talking about what's going on with the patient as well as talking to the patient, is really essential to help manage and mitigate the day-to-day obstacles that are put forth through all of this.
Absolutely. And you did mention the word proactive before, which I love that, because that's, I think, for hospice and probably any other providers, you're trying to keep ahead of it, right? Trying to anticipate what could happen. We introduce this new medicine, or we're seeing this intervention put into place. What's the fallout from that, or what's a potential fallout for that? So sometimes that can be challenging, depending again. Do you have a patient who's actively engaged in their plan of care, or not so much, right? So yeah, I appreciate your saying that as well, because sometimes I feel when I was back in 2 feet on the ground in an organization that I was chasing a beach ball on a windy day. I couldn't quite get my hands on it, but it seems like no matter the circumstances, the goal is the same, is that you want to be able to have that good coordination and that good proactiveness in order to anticipate and manage your plan of care.
Absolutely. You hit that spot on. I mean, there's so many hurdles that get encountered, and some days are just everybody feels better than other days. But better that in I want the visit or I don't want the visit. I want somebody in my home. I don't want somebody in my home, and just really trying to be proactive and preventative, and especially in keeping them safe. We don't want an unintended ED visit or hospitalization just tied by us not being able to reach out and to check in. So being proactive, and as well as trying to anticipate, well, what could be happening? How do we best prepare? And keeping the patient dialed in, as well as if they're thinking about saying, oh no, I'm feeling okay. Well, let's talk about, you really said you wanted to get out and start walking your dog around the block again. How are we going to get there if I'm not there helping you out today? So it's really getting that buy-in and constantly reminding them about the reason why you're there to help them and how you're going to help them achieve their goals too.
Do you think, particularly over the last couple of years, that telehealth has really helped in episode management?
Absolutely. It has helped, that it's giving you another way of checking in on the patient, having a touch point for the patient. I mean, nothing replaces in-person visits, by actually able to see not only them full body, as well as any other obstacles or barriers that could be in the home, that they may trip or fall on and things like that. But doing some sort of telehealth visit or care call gives that patient that added touch point of somebody checking in on them. And, quite frankly, oftentimes the clinician may be the only person that they hear from in a day. I know that kind of sounds a little sad and depressing, but oftentimes that clinician is the only one maybe checking in on them on some days. So having that call that they can say, something's going on, or thanks for checking in, I'm doing great, or I feel stronger today, it is a great way. And technology, it has come so far in helping us to be able to do that and to make sure that patients are being safe within their home, and as well as just checking in on them on how they're doing.
I can't agree more. I see such benefit of telehealth just being such a great adjunct to in-person visits. Like you said, it's that extra touch point to really just say, how are you doing today? Is there anything you need? Is there anything new happening? Or even just, being that connection for them if they're living alone and they don't have anyone else to talk to for a day or two, or even many days, until the nurse or the therapist comes again, right? Or the aide. So you said the magic words, value-based purchasing. Let's talk a little bit about that. As it relates to episode management, how do you think is an episode going to be impacted by value-based purchasing? What are your thoughts on that?
So, episode management, it has a significant role in value-based purchasing. I would say it puts more emphasis on the plan of care, as well as just how we manage the episode completely. So if you think about the breakdown for value-based purchasing and how that TPS score is calculated, you got your OASIS-based measures, your claim-based measures, that include the acute care hospitalizations and ED usage, and then the last piece of it being the HH caps surrounding the patient satisfaction,
Right.
that's really where episode management, it plays a role in all of these. So from the beginning when the patient's getting assessed to setting up that plan of care, to then at the end of, well, is the patient satisfied with those services? It has touch points all along the way. So episode management really plays a key role in all of these. So after that assessment and evaluation are complete, I mentioned earlier that communication among that care team is critical. Developing that plan of care, tailoring it to the patient to make sure that it addresses the patient's goals and their needs, making sure that the interventions are included to address patients' areas of risk that could drive to rehospitalization or ED use as part of it. You really want to make sure that agencies are looking to establish processes and guidelines for their staff around front-loading care for patients that may be at high risk of rehospitalization, how to prevent gaps in care by rescheduling missed visits timely. As we talked a little bit about some of how you splice in, if there are any missed visits, care calls or telehealth visits as fillers in between if you can't get out there. And care coordination and collaboration, that's a key piece into the patient's oversight. You want to make sure that the patient's improving towards their patient's stated goal and making sure that they're ensuring any barriers to care are identified and appropriate modifications are made to that plan of care. If it's adjusting schedules, identifying other disciplines needed, adding in those care calls, increasing the touch points to really make sure that especially when the patient could be, when they're the sickest, when they first come on service and they have the highest acuity, that we're preventing any emergency department visits or hospitalizations. As part of that, you really want to also look into the continuity of care for the patient. How do we make sure that through that we're constantly reminding the patient, as we talked about, why are you there? To help make them better, but most importantly, to work towards them achieving their patient stated goal. I made the reference of walking the dog, granddaughter's getting married this summer, want to get back to going to coffee in the morning with my friends. Whatever
Right.
it may be, you want to see them, you want to keep bringing that back to the forefront of, well, we got to do this so that we can get you back to doing what you love the most. And that really helps on driving those patient satisfaction scores. The patient engagement piece is really crucial to the success of the home health care plan, which then directly relates to the agency's success with patient satisfaction, value-based purchasing, and overall achievement of performance outcomes.
Oh my gosh, this sounds like a lot of pressure for home health providers to be entering this kind of a payment methodology. What do you when you think about that is coming in January? How can home health providers? Well, I would hope they're starting to prep for this, but how do you think home health providers can get their arms around this, and what should they be doing right now to get ready for this kind of an environment of quality driving payment?
Yeah, preparation. It started yesterday, and and
Right.
obviously there were the I guess the good for some of the listeners, depending on where they are, they may be in states that are already part of value-based purchasing, but for the others that may be listening in non-value-based purchasing states, that they need to know what are lessons learned, what should I be doing today, how do I prepare as this rolls out nationwide, and the agency should focus in on reviewing the value-based purchasing. It's a preview report that CMS recently released to identify the specific areas where they fall below the CMS national median and 90th percentile benchmarks. So in areas where they fall below the benchmarks, that's really where they should prioritize based on the weighting of those items and how that ties back to that overall TPS score. And when developing their plan for improvement, they should consider, what are their current performance improvement projects? Where are they with them? Have these projects already had the potential to impact the areas? Because you don't want to make sure that you're duplicating efforts. If you've already been putting a focus on it, how do you then benchmark again? But if you think in any of these areas with looking at patient satisfaction scores. Okay, what can we do to improve those by, dropping buzzwords within visits and, encouraging patients to complete them? Or how do we increase the continuity of care? The other big area being in the rehospitalization and ED usage. Let's do a look back. Why did we have hospitalizations and ED usage occurring? Let's look within the record. Were there gaps in care? Were there missed visits, patient refusals? Did we not get out to, what prevented us from getting out to see the patient? Was it within our control or not? Sometimes some of these things are outside of our control, but once you audit some of those, trend out what the findings are, and then take it back to say, what do we do from a process, procedure? How do we change and do more education? Then you educate, and then go back to say, well, did the education stick? Then you go repeat the cycle to say, are we seeing improvement in these areas now that we've reviewed, put corrective actions in place for how we're going to improve these, and then continue to revisit them to make sure that you're trending in the positive direction.
So it sounds like the quality piece of this value-based purchasing, which I love. I love that there's accountability, if you will, to reach a certain threshold in quality. You have to perform X in order to receive incentivized payment. Do you think, as we look at this value-based purchasing model and episode of care management, that some providers are going to struggle with that in order to meet those quality goals that are set there in order to get that incentivized payment? Do you think that's going to be an issue?
It can be an issue. Depending, there's a lot of factors that go into it. When you think of being scored across the nation, where you only have small cohorts and large cohorts, depending on the size of your organization, the sophistication of your organization, from I would say an electronic health record, or by having data at your fingertips that you can track, trend, monitor, being able to quickly deploy changes. I mean, sometimes you think of the nimbleness of an organization from being able to quickly implement a change may work better on a smaller to mid-size than a large national chain. It may take them a longer time to roll out said changes in education. So there's a lot of pros and cons and different things that work for agencies of various sizes, but being able to have access to the data, as well as then having a team behind you that's constantly reviewing, tracking, trending, digging into the charts and finding where there's areas for opportunity. There will be opportunity, and as in everything, there's going to be winners and losers to it.
Right.
And how you think about it, how you respond to it, react to it, as well as how much you prepare for it, all tie into what the chances are for success within the value-based purchasing program.
Wow, this is just a lot that's happening to home health. And like I said before, I like the idea of the quality proposition built into driving that episode of care. So hopefully organizations can see the benefit to it in the long run, because we all want patients to have the best quality care they possibly can have, no matter, whether they're receiving home health or an inpatient hospital stay or even at end of life in hospice. So, Maria, we've come to the end here, and I wanted to just ask you if you have any additional thoughts you'd like to share with our listeners before we wrap up.
Wow, what to share with everybody. I mean, we covered a whole I guess, listing of topics and takeaways for them. But what I'd really like to share is be thoughtful, be proactive, never stop listening and learning. Great podcasts like you put on here, Jennifer, of just always having that opportunity to listen to what others are doing, listen to the advice that they have to share. I mean, within podcasts and things that CHAP puts out, as well as other things such as on the website, newsletters. Always, there's nuggets in everything that you can take away, and how you take that and connect it back into your organizations, or bring it back to a meeting and say, have we thought about this? Or what are we doing to prepare for that? There's just so many things out there to leverage to help you be prepared, and to help you, not only yourself, but your organization be the best version possible. I would say that's my advice to everybody, of never stop being a perpetual learner and looking for what's out there, especially with value-based purchasing on the horizon. There's so many things that you may say, well, we do these things every single day, but taking one step further of how do we do it better, and how do we drive the quality of care for the patient, how do we improve our outcomes, and how do we increase our patient satisfaction as all part of it.
Excellent. Continuous quality improvement. I love those words. So thank you so much, Maria, for joining us today to talk about this really important topic. And hopefully everyone who's been able to listen to the podcast today will have some great takeaways from Maria about managing an episode and preparing for value-based purchasing. So to all of you out there, thanks for taking time out of your day to plug into our podcast. And hopefully you are taking away a pearl of wisdom from this discussion. Thanks again. Stay safe and well.